What is going on that's causing this overall decline that is causing the fertility crisis?
We're in a world of trouble. I don't know what's going to happen in the next 50 years, but we got to make meaningful changes today.
But how does the testosterone affect the sperm?
Your natural testosterone production leads to good sperm health. When you're taking shots, you're shutting down the natural system. You're shutting down the body's ability to produce sperm and testosterone. They just get on testosterone starting at the age of 22, and then they're 26 trying to have a kid, and I have no sperm.
Can you explain more about the semen analysis? What is the semen telling you that the blood's not?
The semen analysis is basically like it's the sixth vital sign. That's what we like to say. If you're not healthy, if you're stressed out, if you're not exercising, if you're eating poorly, if you're not doing the things that are important for overall health, obviously your semen is going to be thrown off because of it.
One thing that they can get started with this week to just completely transform their health in a few months. Never in my life did I think that in my career I would be talking about sperm 24/7, but here we are. And I learned from my own fertility journey that sperm is not only critical for the fertility equation, but once you start optimizing sperm health, overall men's health flourishes. So let's hear it from the doctors. Can you talk a little bit about the link between sperm health and overall health? And why should men be paying attention to their sperm parameters?
Sperm health is really a marker of overall health for a multitude of reasons. So you need a normal level of intratesticular testosterone for your sperm to function effectively. So right off the bat, if you're trying to conceive, or even if you're not, you want to have a normal intratesticular testosterone level. And one of the things to keep in mind also is, like, one of the earliest signs of low T in a man, if you want the poor man's testosterone test, is if you stop having morning wood. Morning erections are like earliest sign that your testosterone level is low. So in order to make sure you're getting optimal health, you want to make sure you're getting enough sleep, at least 7 hours of sleep a night. Exercise is super important. I tell all my guys 30 minutes of exercise at least 5 days a week. You want to eat a healthy diet, Mediterranean diet, healthy grains, whole vegetables, whole wheat, lean meats, all that stuff. And then just generally, fertility supplements are definitely going to be helpful and advantageous. You want to reduce the reactive oxidative stress on the sperm and, create the overall milieu that will optimize your success.
As a man who's 42 years old, when do I stop getting a morning wood? Or does it ever stop?
Eventually it does stop. I mean, like, if you take all comers, about 50% of men by age 50 have ED, and that's not even taking into consideration guys that are on blood pressure medication, because blood pressure meds are boner killers because they reduce blood pressure not just in your neck, in your head, in your arms and your legs, but also in the penis. So I would say probably around age 50 is when most guys come in and they tell me, like, yeah, I'm not getting morning wood anymore. It happens even much earlier than that. I get guys like 25, 28 in my office saying, like, I'm not getting morning wood, haven't had morning wood in 5 years. And like, whoa, what's going on? Obviously, you want to check a whole hormone panel, make sure they're optimized from the testosterone standpoint, and then look at their metabolic factors. Lipid panel, what's their cholesterol like? Do they have diabetes? Are they exercising? So it's really a multifactorial approach to take.
So what you're saying is the root cause of that can be some sort of underlying issue that has to do with not just your hormonal status, but other things that are going on?
It's like metabolic disease can be a problem. If it's a hormonal issue, that's one thing. If it's environmental, now we have these microplastics that are affecting, the hormone pathway, these hormone disruptors. So it's really a multitude of things. Yeah. And obviously eating healthy, getting enough sleep, exercising, minimizing stress, obviously that cortisol response, getting norepinephrine and epinephrine on board all the time, just kind of keeping in that heightened state of excitation and fight or flight. That's not going to be helpful with like being able to achieve an erection, for example. And I'm going to stop talking, I swear. The thing to keep in mind is that an erection is a relaxation phenomenon. And I tell guys this all the time. And I know when I came onto your guys' podcast, I know it was Sean, I was telling you guys, there's this term that I coined, like periconception ED. And it's guys coming in to see me in my office where around the time of conception, they're just like very stressed out because they're like, I'm at work all day. I come home and my wife's like, okay, I'm ovulating. It's go time. And the guy's like, well, I'm tired and I need to decompress. So having to engage in intercourse under like stress, and that could be from a multitude of things, you got to keep in mind 400 years ago when we were living in tents and huts and whatever, 500, 600 years ago, the threats and stressors in our lives were not the stresses we're encountering today, where it's like work deadline, relationship stress. Oh my God, this person posted about so-and-so on their Instagram. Like all that stuff is not the stressors that we had 500-600 years ago, where it's like, okay, the neighboring tribe is clanning with us and there's famine. Okay, these are not good times to get erections and have kids. So when you think about something like norepinephrine that's on board when you're stressed out, it's going to completely counteract your ability to get an erection. So same thing with today. The stressors are not existential, but the norepinephrine in our bloodstream is essentially counteracting your ability to get an erection.
So for a person who has no idea on all these big words that you're saying, how can we simplify these words when we're...
So minimizing the stressors in our lives, and especially, around having intimacy and all that stuff, you need to create the environment where stress is minimized, because these stress hormones really prevent you from getting an erection.
Okay, so just to continue on the topic of erectile dysfunction, I will say, like, for us at WeNatal, I was just sharing with Dr. Human, we did a clinical study and we found that men who took WeNatal for 3 months, which is an antioxidant, so it kind of slows down or reverses the impact of oxidative stress on sperm, also had higher libido, less incidence of erectile dysfunction, better erections. We can't really say that in marketing. I think we say better sexual desire or something along those lines. That's the PC term. We see amazing things when people put in the right inputs. And so I guess the question is infertility, a lot of times people will, potentially go down the route of IVF and they just extract one sperm. But why is it important to pay attention to what is going on with your sperm, and how does that then impact your overall health?
Yeah, so Ari and I, we did residency and fellowship together. So a lot of the stuff we trained together. So a lot of the stuff we both kind of preach the same thing. But not to fully piggyback on what he said, but a semen analysis is basically like it's the 6th vital sign. That's what we like to say. It's if you're not healthy, if you're stressed out, if you're not exercising, if you're eating poorly, if you're not doing the things that are important for overall health, obviously your semen is going to be, thrown off because of it. No one really checks their semen analysis. Nowadays, it's much easier to do. You could do like at-home testing. There's a number of companies. You just order a test kit, you do it at home, you get your results. And it's a good place to start. To be honest, every guy should probably, check their semen at some point if you're in your 20s and 30s, irregardless if you're trying to conceive at that time. It's just a good place to start to see where you stand. But to your question in terms of why it's so important, it just gives you another data point to act on. But yeah, it's really do the things that are important for your overall health, like your cardiac health. And again, all the things he talked about, Ariel talked about, exercise, sleep, diet, and stress reduction. Those kinds of things will only help your sperm quality.
I think when we look at the stats around sperm and testosterone that have been declining by 50% in the last 50 years. Actually, I don't know if you saw the new Israeli study that came out last week with sperm counts testosterone has declined across all age groups by 53% in the last 50 years. So the question is what is going on that's causing this overall decline that is causing the fertility crisis?
So the hormone disruptors in the environment, and I personally think cell phones also. Think about it, like guys put their phones in their pockets all the time. It's not the radio frequency from the phones, it's actually the Wi-Fi. So you want to turn off your Wi-Fi if you're going to put your phone in your pocket. There's a study published about 3 or 4 years ago looking at Wi-Fi radiation is the factor that causes impact and impairments to motility and morphology and concentration of the sperm. There's also now, think about all the different types of like even Wi-Fi radiation. Every place you go into in the public space has Wi-Fi radiation. There's, a lot more people are getting imaging, like all this other stuff, environmental factors, the foods we eat, everything's much more processed. So there's a lot of things in the environment that we just don't know yet. We don't have the technology to understand exactly from a molecular standpoint what the impact is from environmental factors that have changed in the last 50 years. But yeah, it's definitely frightening. I mean, when you think about it also, there was a study published a couple of years ago looking at babies born and like genital size and testicular volume has also declined over time. So we're in a world of trouble. I don't know what's going to happen in the next 50 years, but we got to make meaningful changes today.
One thing that I love, and one reason why I talk about sperm so much, is because of this ability for sperm to regenerate. So can one of you talk about this idea of spermatogenesis and like what is going on with men and how they can completely transform their health in a few months?
In terms of what else is going on, I think low testosterone, right? That low testosterone is a big thing. So everything that Ariel said causes sperm issues as well. But and not to get political here, but like what Pete Hegseth said yesterday, in terms of screening men at the age of 30 for low testosterone. It's a real epidemic, right? So if you have low T, you're going to have poor sperm quality. So I think all of this it's not just low sperm, it's also men who are experiencing low testosterone. You know, we see guys in 20s and 30s with erectile dysfunction because they have low testosterone. And you could go along people aren't exercising or indoors all the time, we're not getting vitamin D. Those are all the things that are causing low testosterone. But I'm sorry, your question was?
How does someone know if they have low testosterone what are some symptoms that they might feel?
Sexual dysfunction, erectile dysfunction, low libido, exercising, but you're not really putting on, you're not noticing the gains. You're having difficulty exercising compared to like what you used to. You used to exercise a lot better, but you're not exercising the way you used to. Putting on weight, mood, anxiety issues. I don't know if there's anything else.
Brain fog.
Brain fog.
It's a big one. Guys come in saying like, oh, I just have a lot more brain fog, forgetfulness. Also sleep impairment too. Poor quality sleep not only worsens your testosterone level, but if you have a low testosterone level, your sleep quality gets impacted also. So a lot of these guys, when we normalize their testosterone levels, one of the questions I ask in the follow-up is, how are you sleeping now? And a lot of times they say, oh, my sleep quality is significantly improved.
But how does the testosterone affect the sperm? Exactly. Or if I'm getting these shots or these injections to increase my sperm, how does that affect the overall?
So this is the thing that guys really like. You got to be very careful here. So intratesticular testosterone, like the testicles make testosterone, they make sperm, but your natural testosterone production leads to good sperm health. When you're taking shots, you're shutting down the natural system. You're shutting down the body's ability to produce sperm and testosterone. I mean, I see it a number of times every week. I'm sure you do too.
All the time.
Guys who go to these testosterone clinics, these mom and pop or these, shopping center clinics, they just get on testosterone starting at the age of 22, and then they're 26 trying to have a kid, and like, I have no sperm. It's like, well, you're on these shots. Like, oh, I thought testosterone helps sperm. It's not that kind of testosterone. So if you want to boost your testosterone and you want to have a kid, there's a way we can do it, and we can do it very, very well. You just have to. It's a different treatment plan. And that really works. But ultimately, like these things, like anything else, you really want to do everything under the watchful guidance of someone who knows what they're doing.
Right. So just don't go to the websites and get these peptides and
Careful with this stuff.
yeah. Does your testicular size matter to testosterone or sperm production or rejuvenation of any of that?
Yeah, I mean, to a certain extent, it matters. Yeah. If you have small balls, you're not going to have necessarily good sperm production or testosterone.
I would say they matter insofar as to say most people actually don't know that the vast majority of your ejaculative volume is coming from the prostate, not from the testicle. So the testicular volume contribution to the overall ejaculative volume is pretty negligible amount. That's why after a vasectomy, most guys don't notice a difference in how much volume is emitted, because most of the volume is coming from the prostate. Only a small amount is the actual sperm coming from the testicle. So size partially matters.
So if somebody here is potentially done having kids and they have low testosterone, where do they start?
I mean, look, you want to check your testosterone levels. You want to do it once, you want to do it twice to make sure you have low T. And then depending on what your age group is, you really want to figure out, you want to come up with a good game plan for TRT. It's wonderful. Like, it really is great. Like, I look forward to the day I'm on TRT. But you also have to remember that if you're on TRT, you're on it, you're kind of on it forever, or you're pretty much on it lifelong, because you're shutting down, again, you're shutting down your body's own ability to produce testosterone. So to come off of it, you're going to feel like crap. So to my earlier point about ways in which we could naturally boost testosterone levels, if you're done having kids in your 40s, there's ways we could give you medications that, again, tell your testicles produce more testosterone naturally. And that could carry on to potentially your 50s, and then into your 60s, you could start TRT. But, again, there's so many options. You want to talk to someone who knows what they're doing.
So are you talking we had a little discussion. Are you talking about starting off with like a Clomid?
Yeah, like a Clomid, HCG. These stimulate natural testosterone production, and then you could go on to a replacement program.
And so what would be the doctor that people go see for that? Would it be, I feel like in men's health, like for women, we have our OBs, we go to them for everything. Men are a little bit like, I don't know. I feel like it's the wild west for men.
you
They don't
start-
really know, like they don't have like a person.
Yeah.
So is that person a reproductive urologist or?
You start at your neighborhood shopping center. No, one of us, reproductive urologists, we focus in mainly, andrology background, which is like the scientific term for like the study of men's hormones. You can see an endocrinologist. You can see your primary care doctor if they feel comfortable prescribing it. Some do, some don't. There's no such thing as a free lunch. Being on TRT or testosterone replacement, for example, there are potential downside risks. Number one, it can stimulate your bone marrow to increase your blood cell production. Your blood becomes, for all intents and purposes, a little more thick. If it gets too thick, you got to go and donate blood every so often. Get a phlebotomy. So it can increase that. It can potentially, if someone has prostate cancer, it can cause prostate cancer to grow. Testosterone replacement doesn't cause prostate cancer, but if you have like microscopic prostate cancer cells, it can essentially add fuel to the fire. So you want to make sure before you start TRT, you're getting screened for prostate cancer. Check a PSA, maybe do a prostate exam. What else?
So every year I go to the doctor, I do a full panel blood check. Now, do you recommend that guys who are going through the fertility cycle or anything else to come to you guys on a annual basis as biomarkers so they can determine whether their sperm or how healthy they are outside of just a full blood panel?
Yeah. So this is the problem in medicine in some ways, because you're going to do a blood test, you get your testosterone levels. Normal testosterone range is from 300 to 1,000. Okay. Which is huge, right? And for me, like maybe 400, 450 is perfect for me. Whereas, Dr. Murad's here, he needs to be in the 800s, right? Who knows what Sean needs to be at? So you don't want to, you really can't, this is not one size fits all. So like a primary care physician, in some ways, not everybody obviously, but if they see a patient whose testosterone level is 310, right? It was like, well, your number's normal. But then if a guy comes in, he's 290, he's like, well, it's abnormal. It's just a mild variation. It's quite subjective. Or he's treating it very objectively, excuse me. You have to treat, it's more like testosterone replacement therapy is more of it's an art, not really a science. You want to treat the symptoms, not the number. To your point about, primary care, blood tests, that's just one part of it. If you're having symptoms of low T, see somebody who's willing to address your symptoms of low T.
I'm going to piggyback onto that. Just exactly what Justin said. We treat the patient, not just the number. You can have a patient come to your office, testosterone level, like let's say 450, but they're like, I feel like crap. My recoveries from workouts take a lot longer. I don't sleep well. I'm gaining weight. It's hard to put on muscle mass. That guy, you don't have his testosterone level from 5 years ago. He may have probably been living in the 700-800 range. So for him to be, let's say 420, that's low, even though he's technically in the normal range, which is from 300 to 900 or 950.
So would you recommend for those who there are a lot of people here that have boys, and do you recommend checking that number like as a reference point so people kind of know where your levels are at? I feel like nobody really checks that number unless they have issues. So at what point should a man or a young boy check their testosterone levels, their sperm, to know what's optimal for them?
It's a good question. I don't do pediatrics, so I don't know. Maybe 20, I don't know.
Well, yeah, I would say I wouldn't necessarily get a baseline testosterone. Check your testosterone if you're having symptoms. I mean, who cares if you're feeling good and your testosterone is 600? Great. Kind of waste of time to check your testosterone. Just check it if you're having symptoms, and then you act on it. But a semen analysis, I think everyone should get a semen analysis at some point. As a place to start.
So testosterone is not checked through the semen, right? It's checked through the blood and everything else.
Yeah,
so just a normal blood test. So can you explain more about the semen analysis? Because that's where I'm curious about. What is the semen telling you that the blood's not?
Well, it's a couple of things. There's some reversible. So look, when someone has low sperm counts, it could be for a number of reasons. Genetically, they're not producing any sperm, and that's one bucket. But there's medical ways we can improve your sperm, and then there's surgical ways. And like anything else in medicine, right? The earlier you intervene, the earlier you address it, the better off you'll be. So if you have a varicocele, for example, right, which is like the dilation of the blood vessels of the testicle, that damages your sperm. The earlier you address that, the less permanent or the less long-term damage it causes to the testicle. Therefore, your sperm counts are going to improve earlier on. You're in your late 20s versus your late 30s. And you're not delaying. Let's say you're trying to have a kid, you wait 6 months with your wife, and you're like, oh, now I have a varicocele. Then you fix it, and to your question about 72 days, it takes 3 months for sperm to improve from the time you do the intervention to the time it's ready to be produced. So the earlier you address it, like again with anything in medicine, the better off.
So what that means is you're currently making the sperm that you'll have in like October, for instance, right?
That's ejaculated in October, yeah.
Yes. And that's why I mean, for us women, we're not making eggs all the time. We can improve our egg quality, but men have this unique ability to constantly produce sperm, which is amazing. And so there's so much that they could do to improve their fertility outcomes and overall health.
Oh yeah, big time. If you're smoking, if you're drinking, if you're sitting in saunas, steam rooms, jacuzzis, all of these things are bad for your sperm. Stop, go cold turkey with all of those things. In 3 months, maybe 4 months, you'll notice an improvement. If those are the culprits, if those are the problems.
What do you mean by improvement? I'll see more liquid. I'll see thicker liquid. What am I?
The quality of the sperm.
But I won't be able to see that naturally, right? It would be a semen
If
test.
you did a semen test, you would see the results. I don't think it's visible to the eye
Yeah, it's not an
unless
eye
you have
You're correct.
some microscopic vision.
Is there any other kind of test that you can do at home? Taste, look, feel, anything? It's a genuine question, honestly. Like you know, I don't know. I hear pineapple's really good for you, and I'm just going off those things. No, I don't know. I hear pineapple's really good for you, and I'm just going off those things.
No.
Pineapple is good for you. For the taste, it is actually.
Is it?
Yeah, it is.
Yeah, it's a thing.
It really is a thing.
Yeah.
Oh, there you go. Pineapple is a thing for semen taste, guys.
For sure.
It is a good thing.
Let's stick with kind of these common behaviors that are legal here in California. Can you talk a little bit more about those and why do they impact men's health, sperm quality, maybe even testosterone? Marijuana, smoking, vaping, even alcohol.
Yeah. I mean, look, people are always having kids when they're doing these kinds of things. So it's not like you have to go cold turkey with any of this. You don't have to be so strict. But if you are having issues, try to be a little bit more strict about it. But alcohol, I'd say it's more binge drinking. I don't know it's more the binge. If you're having like 4 or 5 drinks in a night, that's you're causing problems to your sperm. 1 to 2 drinks a couple times a week, maybe once or twice a week isn't bad. Tobacco is not good, whether it's vaping or cigarettes, obviously. Marijuana, if you smoke a lot, it's not good for your hormones. It throws off your hormones. It kind of raises your estrogen levels, which aren't great. But, for some people, it's an aphrodisiac. So, you get high, you have sex, you're increasing frequency of sex, more likely to have a kid. I'm not so strict with marijuana. I don't know how you are.
I'm maybe a little more. Maybe I'm too strict. I tell like someone tells me like, oh, they vape or smoke cigarettes. I'm like, you got to stop. When they're like, oh yeah, I smoke weed every night or I smoke weed a couple of nights a week. I'm like, you got to stop. The way marijuana works on the brain. So I don't want to get too technical, but the pituitary gland is basically behind your eyes, and it releases 2 hormones to the testicles. One triggers the testicles to make sperm. The other one triggers the testicle to make testosterone. So like Dr. Human said, marijuana use will mess up your hormones. So it's not good if you want to have a normal testosterone level. But from a sperm production standpoint, I really tell guys, if you're trying to get pregnant, no weed. And the thing to keep in mind with this whole 72 to 74 day sperm production cycle, what you ejaculate today was made 72 days ago. So what changes you make to your lifestyle today, you won't really see that in terms of the quality of sperm improvement for about 2.5 months from now. So you kind of want to play a little bit of the long game there. So yeah, I'm pretty strict on weed.
Yeah.
What are some other healthy behaviors that are actually not that good for your sperm quality?
Saunas.
Oh yeah.
I'd say saunas are a big one. People think, they do the contrast therapy, saunas, cold plunge. Saunas aren't good. Anything that increases, like laptops in the lab, anything that's warm here is not good for you. Cold plunge is okay.
Fan.
Yeah, cold plunge is fine. Other healthy.
What about free balling? Is that recommended?
Yeah.
So the key is, I always tell guys, you want to keep them.
I don't even know what that is, but
Going
It's just
commando.
wearing no underwear.
Commando, no underwear. You want to keep the boys cool. So I always ask guys, what do you do for work? Oh, CPA. I sit at my desk 14 hours a day. I'm like, that's not good for your sperm because you're cooking your nuts all day. So I always say, get a standing desk. Every hour you get tired, sit for 10 minutes, but try and stand more of the day. Get looser fitting underwear, none of these tighty whities or, loose, let the boys breathe. So keeping it cool down there. There's a reason why the testicles are outside of a man's body. God knew what he was doing. Not to get religious and political, but I'm going to tell you, God knew what he was doing. So the testicles outside of a man's body are about 1 degree Celsius cooler than inside the abdomen. And that 1 degree Celsius variation is enough for sperm production and for sperm to work well. Like Dr. Human was saying, varicoceles, those dilated veins around the testicles, they become problematic because they serve as a heat sink. You're trapping heat around the testicles, essentially raising the testicular temperature, and sperm production is temperature sensitive. So the key to good quality sperm is keep the boys cool. Don't sit all day. Don't turn on your seat warmer in the car. If you have a cooler in the seat, turn that on. Try and stand more of the day. Wear loose-fitting underwear, boxers over briefs.
And for
Mic
those here who are done having kids, would you say that heat is fine? Like going into the sauna and all of that stuff?
I think, to be honest, you can actually probably do sauna as long as you put an ice pack on it, right? If you put an ice pack on your balls, that's fine. I think
There are actually companies that make these now.
yeah. I think there was some guy who did, what's that?
Like Brian Johnson, I think.
Right. Brian Johnson
did a study.
Yeah, he did saunas and he put
Ice packs on
ice
it.
pack, and he checked his semen analysis.
It's kind of weird to walk into a sauna and actually see that. I've actually had that happen where I'm walking in, this guy's just fully wrapped up. I'm like, what is that? And
Brian
he's all like,
Sorry, where was this? I'm just curious. Was it here? Jay.
no, this was 2 years ago.
Okay.
But yeah. So he's just wrapping it. And I'm just like, what are you doing? And he's all like, oh, this is to keep this temperature of my balls at a normal temp while I'm in the sauna. I'm like, well, why don't you just get out of the sauna and not do it? He goes, well, I'm trying to conceive. So I was like, okay, then I just dropped it at that.
Okay, let's get some questions from the audience. Adam.
If somebody's experiencing hair loss and they're on something like finasteride, how does it work if you do a TRT? Does it affect it? Hair loss? Yeah.
Has it worked to be on TRT?
No, I mean, if you're taking something like finasteride, which blocks the DHT, and you start taking TRT, like, how does that work?
But it still blocks it.
Okay, so it still works?
It should still work, but it should still work, yeah. But potentially to a lesser effect.
Okay.
But as long as you're doing like again, you're not doing too high of a dose of testosterone, you're not going to get that surge that causes the additional hair loss. So
Excess hair loss.
just keep it within a normal range, at least with the dosing. You should be fine.
How important is the use it or lose it component?
So that's a good question. So there's actually a retrospective study when we were in residency together looking at prostate cancer risk linked to ejaculation frequency. And it was a retrospective study. So it was not, setting the parameters, okay, you're going to ejaculate more than 20 times a month and you're going to ejaculate less than 20 and we'll see who ends up getting prostate cancer. It was looking at men who had been diagnosed with prostate cancer and asking them how many times on average they ejaculated a month. The guys who ejaculated 20 times or more had a lower risk of prostate cancer. If you want to be a good partner, I guess, engage in more intercourse so from a fertility standpoint, so there's a reason why, Dr. Human and I, whenever we see a patient and we're going to order a semen analysis, we say, okay, abstain from ejaculation 2 to 3 days before the analysis, because the longer the interval, let's say you wait a week or 2 weeks and then you give your sample, you're going to have a lot fewer motile sperm, meaning sperm that are moving quickly. And then you're going to have impairments in the shape and the structure of the sperm. These are things that, require kind of a repetitive clearance, because the longer they stay in this one part of the testicle, I don't want to get too technical, that's when they're exposed to environmental factors that then cause the impairment to the sperm quality. So yeah, I think routine clearance, especially around the time of conception, is very important.
But would you say routine, every day? I feel like some doctors say every other day. They're not they actually say that every day is not good.
Yeah, I would say every other day.
Yeah, it's like twice every other day, every 2 to 3 days.
All right.
But with erectile dysfunction, if you don't use it, you lose it too. Yeah, like you want to have good, continue to have good erections throughout the course of your life, because if you don't, your penis does shrink.
When you take out a guy's prostate, you end up, and this is kind of off topic, you end up, whether you do a nerve sparing procedure and you spare the nerves that provide an erection or not, there's a period of, the technical term is called neuropraxia, meaning the nerves get injured and you're not getting the nighttime erections after prostate surgery, for example. And the loss of nighttime erections cause fibrosis and scar tissue to form in the penis, because the penis is used to being kind of spongy and elastic. And when you're not getting those nocturnal erections, you get fibrosis and scarring, and that's what causes men to lose length after like prostate cancer surgery. And you get length loss with age for the same reasons, not getting those nocturnal erections. You know, you get these 65-year-old guys, 70-year-old guys, you know, my penis isn't as big as it was when I was 20. And I tell them, this is just fibrosis. This is part of the aging process. They don't tell you this in school.
So he actually stole my question, which is really good. Is it good to have sex often or not as often? And you're saying every other day is the realm. Love like every other day.
Any other questions from the audience? Jet.
Church guys that start going for like the feeler checked out or just seeding, not necessarily testosterone, but just for like prostate, prostate cancer, or whatever, like how about start think or out this thing, I got one age.
So the guideline recommendations age 55 to 69, but most urologists you talk to start screening guys at age 50. If you have a family history of prostate cancer, meaning your father or a brother, like first degree relatives, if your grandfather had it, your risk is the same as the general population. But if your dad had prostate cancer, you should start screening earlier. I'd tell guys around age 45. Also, African-American men start screening at age 45. But general population, good rule of thumb, age 50.
Versus testosterone or direct correlation. Sometimes people have regular testosterone levels, so is there, what's the sign on that? Is there direct correlation or?
Yeah, a lot of times low testosterone causes low libido, a lot of times. But there's some other hormones involved, like estrogen is one of those hormones that's involved for men too. But generally speaking, yeah, I'd say if you're experiencing low libido, more than likely it's a testosterone issue, or it could be an erection issue. If you're having like poor erections, psychologically you're not going to want to engage in intercourse, right? So subconsciously you're not going to want to pursue it. So usually I'd say it falls into those two buckets.
Stress plus.
Yeah, sure, but stress falls into that erectile. Stress is causing the erectile function issues as well.
So a lot of times guys come in the office and they're talking about testosterone and testosterone management when their hope is that you put them on TRT, you normalize their testosterone, that their erectile function gets better. And I tell guys, these are two different things. Low testosterone can cause impairments to the quality of erections, but fixing and normalizing your testosterone level will not always fix your erectile function. So those are just two different things that guys need to always be wary of or be mindful of. Like you can normalize your testosterone level. It doesn't mean your erections are just going to spontaneously get better.
So what else could be going on?
It's not necessarily what else could be going on. He could very well just have erectile dysfunction. So normalizing the testosterone level doesn't always fix the erectile dysfunction. It could very well be that he's got two things going on. He's got ED, he's got low T. So fixing one doesn't always fix the other, but it definitely can help with the normalization of the testosterone level to then take something like a Cialis or Viagra, which then promotes better blood flow into the penis and then makes it easier to achieve an erection.
So does going to the gym, exercising, all of that help with testosterone in sperm production, or just basically if you have low testosterone, you're just fucked? I don't know. I mean, just what naturally can you do without sticking a needle in your body?
Yeah, I mean, not to simplify it so much, but really exercise is great. Heavy weightlifting, so working out your back, your legs, your chest, the big muscle groups, that's very good for testosterone production. If you could do that 3 times a week, 1 day of cardio, that checks off the exercise bucket. Sleep is huge. If you're getting poor sleep, your testosterone levels could drop 200 points compared to a guy who's getting normal sleep, who's the same age as you. I know we talked about this, but the same thing that's good for sperm quality is good for testosterone. So a diet, you want a combination of good, healthy diet, really. You don't have to be super strict with that one, but that's obviously important. And then stress. I know we talked about it, but those 4 things are good for your sperm quality, good for your testosterone production. But exercise, if you want to snap out of it, exercise is the easiest way of doing it.
100%.
And reducing stress is easier said than done.
Yeah,
So
for
what do you tell to your patients who, I mean, stress is not going to go away. So how do they manage and navigate living in the stressful world? What advice do you give them?
That's a good question. Meditation, honestly. I tell guys, look, 5 minutes a day, just start to meditate. Breathing exercises. So Andrew Huberman's big on the physiologic sigh. I know probably people in this room have heard that. It's like 2 maximal inhalations through your nose and a slow exhalation through the mouth. It's been shown to lower heart rate, reduces blood pressure. It's like the physiologic sigh has actually been clinically shown to be effective. So stuff like that, those are like, meaningful ways to, minimize your stress in the moment. I think, honestly, if you're not exercising and you start exercising, that can actually serve as a catalyst to reduce stress, because it's a way of like blowing off steam at the end of the day or in the beginning of the day to set the tone for the day. I mean, aside from that, smoke weed. I don't know.
For us that, let's just say we're healthy, there's nothing wrong, and we're just having, consistent sex, but we're not getting pregnant. What is your recommendation there? I always give the advice of, I release on the thrust in, right? Versus just releasing. I was just very methodical in that, because I thought it was just, at the very tip point, and then boom, you're at the closest that you can to the egg. Yeah, right. Is that
Sean is also a sex coach, just so you know, I'll give you his info if anybody needs.
But no, genuinely, is there a better way to have sex to secure a pregnancy from a male's perspective?
I feel like Justin's going to be better equipped to handle this question.
Well, so I'll say this. If you're struggling, get evaluated. Everyone tells you wait 12 months, but just do it. Do it like earlier. Do it at 3 months. Do it 2 months. There's no hard and fast rule. If you
do it at a month.
Do it in a month. If you're struggling to have a kid, both partners should be evaluated, man and woman, right? Man is semen analysis, the best place to start. And then what was the second part you're talking about? What are the best ways?
Like position is
just
asking.
basically, when do you release, and do you need to have the pressure of going 20 minutes versus just, 5 minutes? Let's just bang it out,
Yeah. I mean, look, we've been procreating for thousands of years, right, as humans. And I know, this whole thing, we're kind of making it sound like you have to do this in order to have healthy sperm. Don't overthink this. All I say, and I probably overly simplify a lot of things, but all I say is, 5 days before ovulation, 3 days before, the day of, the day after. If you could do that, it doesn't matter what position you're in, doesn't matter how long you're lasting, doesn't matter the strength of your erections. Just do that. You're providing enough juice in that environment to hopefully procreate. And then also remember, if it doesn't work out, right, when you don't have a kid, people tell you about their wins, right? No one really tells you about their losses. We see losses on a daily basis.
Every day.
Right? People who are struggling, they come in all the time with fertility issues. A healthy 25-year-old male and a healthy 25-year-old female, if they're trying to conceive, the chances of them conceiving, I think it's around 30%, right? Which is not that great. So if you imagine if it's a 35-year-old guy and a 35-year-old lady, the chances go down. So, if
You
you're
mean each month?
each time you get
general.
right, each month. So remember, it's these things that do take time. Just be patient with the process. And if you're struggling, get evaluated. It's the best place to start.
Yeah, and I feel like we're very lucky to live in Los Angeles, where we have doctors like you, because I do think that we've heard some stats that 1 out of 4 couples who go through IVF don't even have the male partner checked. So luckily, I feel like your realm there are not many reproductive urologists out there.
6 in Southern California. Maybe
6 in
7.
Southern California.
Yeah, when we started, it's becoming a little bit more of a commodity. But when we started, there was very few of us.
We're like
You were the only
30% right here, just between the two of us.
Yeah, seriously. There's
All of Southern California, yeah.
there's
So
very few people who do
we're
it.
very lucky to have the access that we have. So anybody here in this room, obviously, go seek out the care of the amazing doctors that we do have here in Los Angeles. One other question, just talking about lifestyle. At WeNatal, we talk about diet and lifestyle to support fertility, overall health. Protein is having a moment.
Oh, love protein.
For men's health, longevity, what is your recommended guidance on protein? Like how much protein? How much is there too much protein? What's the sweet spot for men?
I just tell, I tell everybody, protein's super important. You need it for muscle development. As we get older, especially after age 50, you start losing muscle mass every week, every month, every day. So protein's the building block for muscle growth, and you obviously need to replenish that. I don't have a strict guideline. I mean, maybe 100 grams a day, but I know some people say it's like 2 grams per kilogram, yeah,
So
of body weight.
One
like 100
gram per pound.
Yeah.
On average.
Yeah. So like 150 or 180, whatever, how much people weigh.
And that's just outside of meat and poultry. You can get it through your
You can get it through the WeNatal.
lungs.
Well, what a great opportunity to plug our product. Everybody here will be leaving with our men's protein powder, which also has a full spectrum prenatal in it and collagen. Adam.
Do any of the GLPs affect testosterone?
I don't know, Justin, you want to speak on that?
Yeah, there was something that came out like this past month. Yes, the answer is yes. You're metabolically healthier, so as a result of it. Yeah, for sure. GLPs are great if done appropriately.
Also, I will say this, like men store fat in their abdomen, and fat cells have this enzyme, I'm going to get technical, but aromatase, that converts testosterone into estrogen. So if something like a GLP-1 inhibitor is lowering your overall, not your, but someone's overall, let's say like adiposity or abdominal fat, you're getting less conversion of testosterone into estrogen. So your available testosterone is actually going to go up because there's going to be less conversion to estrogen. So, to Dr. Human's point, like these things all help to overall improve the milieu and your testosterone levels.
And your fertility. It improves your fertility too.
We're seeing the same thing on the women's side of things, that a lot of people are having these quote unquote Ozempic babies, thought they were infertile, were able to kind of lose some weight, balance their blood sugar, and as a result, get pregnant.
Back on the topic of protein, is creatine, do you recommend it? Do you not? So see, like that's also having a moment.
Yeah, it's huge right now. The thing to keep in mind is creatine essentially forces water into your muscles. So you're going to gain water weight. That's something to keep in mind. Your shoes might feel a little more tight and your pants might be a little more tight, but creatine's definitely having a moment. You'd ask like, oh, what's something that's overhyped? I don't think it's overhyped. There's a lot of data now on like cognitive function in creatine, like cognition. There's anecdotally between our group of doctor friends, one of our friends was up operating all night and only got like 2 hours of sleep, but he pounded 20 grams of protein in the morning and was flying all day. So I think there's a lot of benefit to creatine.
So 10 milligrams for brain health, 5 milligrams for fitness.
Grams, yeah, 5 grams, yes. I'm not aware of any.
It probably improves.
Yeah.
You're going to work out more. You're going to lift more longer in the gym, so your testosterone will go up and your fertility will improve. If you do it for long periods of time.
More muscle mass, less. You could take up to about 20 grams a day, but I think I would start with 5 grams a day. You ought to also think these things impact, the kidney function too. You can't overdo it because the kidney has to filter all the creatine and everything else you're ingesting. So no, it's really the THC that impacts the pituitary gland in the brain. I think CBD is fine. And also if it's just like a topical, you're probably not going to absorb a lot into your bloodstream for it to have like a meaningful impact. Is there no one else?
Vasectomy and testosterone, is there an effect?
Zero impact.
Zero.
No, zero impact. Vasectomies are super safe. It takes 7 minutes, 8 minutes, zero impact on erections, testosterone. The only thing it stops is sperm production. That's it. Sperm in your ejaculate. And he mentioned it earlier. It doesn't even impact the ejaculate volume. And you won't notice it. You'll never notice you've been having a vasectomy.
And then men sometimes say, well, what happens to the sperm? And I always tell them, think about a man makes sperm every day of their lives. So these 90-year-old guys in nursing homes, they're still making sperm, but their testicles are not, the size of wheelbarrows. Whatever, whatever doesn't get ejaculated after a certain period of time, your body just breaks it down and reabsorbs it. Yeah, so totally safe.
Can I ask one more?
Sure.
TRT and Clomid, is there a problem with taking both?
No, you're preserving. I mean, this is the part where it becomes a little bit more of a, a little bit more of a science. But you could be preserving your fertility while also taking testosterone.
Okay.
Yeah.
It's not an exact science, though, if that's,
Okay.
But it can help with testicular size preservation, too.
Safe to do.
Thank you.
Okay, we talked about a lot of topics. If maybe would love to hear a word of wisdom from each of you. Like, what would you want to leave these men with? Like, one thing that they can get started with this week to just start feeling better, focus on improving their hormonal status, and yeah, just one thing. Where do they start?
Exercise, protein supplementation, creatine. Those are my 3 words of advice, phrases of it.
I'll just say, if you're struggling, whether you're as a couple, just early evaluation is best, right? And again, people tell you about their wins. No one tells you about their losses. You're not alone in the struggle. There's plenty of people who have been there before you. There'll be plenty after you. Just get evaluated.
WeNatal for him. Telling before this, we actually did a scientific test on WeNatal for him. I was asking the question, does this help with my libido? Does it help with erections? Because, every night I had one, it was affecting my sleep in a lot of different ways. And every morning I would wake up with one. And when I didn't take the pills, the WeNatal for him, things changed as well. So I will say that the testing came after me saying that, hey, it does work. And
I started taking that over 2 years ago, local trimer. And I noticed that after a couple of months,
a huge difference. Yeah.
Nutrients make a big difference to overall health, and a lot of people are walking around super, unfortunately, malnourished. And so these they're not basic, multivitamins and antioxidants that help support your overall nutrient reserves in turn impact your overall health, your libido, your energy levels. We hear hair growth for men. And we actually validated everything that we've been hearing from our community in a clinical study, and the results were amazing. So take your vitamins, drink your protein, get your creatine in, get some exercise, and
ejaculate
have fun.
every other day.
Thank you.